Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast. Today, my name is Terry Fletcher. Happy to have everyone here today. It is the 181st episode of the Codecast podcast, and you are ready for the second quarter of 2021. So today I wanted to give you some insights to the first quarter Medicare regulations that have been announced in the last few weeks, but also remind you that you have a first quarter webinar update if you'd like to attend that I am presenting for the National Society of Healthcare Business Consultants. So this is scheduled for April 15th. It'll give you all of the updates, the links, the information for your providers, and you can register at nschbc.org or go then to the tab of upcoming education, and then the drop down will say quarterly provider updates. So you don't want to miss this because your provider is going to be on the hook for many changes that are being implemented, and there are going to be a lot of effective dates in April. So that's why I like to do each quarter, and I have 4 quarters of Medicare updates. So the first one for the first quarter is April 15th. So again, hopefully you will have registered for that, and I'll get to see you on that. But I'm going to give you just a taste of what you're looking for. Not everything, otherwise we'd be here for over an hour, but just a couple of things that I think are going to be important. And then I also want to talk about in my coding question, depression screening, because that has been a big topic lately. So we really want to take a look at that. First, the Codecast is also brought to you today by JP Morgan Private Bank. Connect with over 200 years of experience, service, and stability. JP Morgan Securities, JP Morgan Chase Bank, privatebank.jpmorgan.com. Okay, so let's go ahead and get started. And one of the things that I wanted to look at, or I should say bring to your attention. Now, you shouldn't be surprised at this, but I know there was a lot of providers who were, but I could not have been strong enough when all of the provider relief funding came out. So if you ever hear that acronym, PRF, Provider Relief Funding, that's what we're talking about. The HHS dump in your account that you've had twice in the last year, the PPP loans, the EIDL loans. I mean, you name it. There's been all kinds of things that have been called, and I'm air quoting, loans. And many of them have been forgiven if you can tie it back to losses and expenses during the pandemic and things like that. But there was one thing, and I discouraged everybody from doing it. Unfortunately, I did have a couple of practices that decided to do it. And of course, now I'm getting these emails saying, I thought they were going to forgive this. I'm like, why did you think that? We're talking about the accelerated and advanced payments from Medicare. And that was from last year. And what that was is, for just a recap, is that you could have applied for monies that you were anticipating getting from Medicare payments down the road. So Medicare basically was giving you an advance against payments that you were going to get later on. It was kind of like going to a check cashing place and saying, hey, my paycheck's coming on the 12th, but can I get this money on the 8th so I can pay some bills? Which is it's just a problem, because it was clear from the beginning, no matter who was in the administration, that this was a loan. The only reason they extended this, and it really shut down pretty quickly, they did it for about 4 months, was because everyone knew that they were already getting the HHS money. There was so many other avenues of money, and I hate to call it free money, but money that was going to be forgiven under the right circumstances. This was not one of them. And so the MedLearn Matters and the transmittal came out. And if you want to look it up, it's SE, so S as in Sam, E as in elephant, 21004. And what this is repayment of COVID-19 accelerated and advanced payments started on March 30th. So that was last Tuesday, so a week ago. So it informs providers and suppliers who requested and received CAAPs, okay, so those payments, that they began recovering those payments starting last Tuesday, depending upon the 1-year anniversary of when you received your first payment. Remember, it's already been a year now. It also gives information on how to identify recovered payments. It also recommends that you make sure your billing staff are aware that the recovery has begun, and that you will begin soon, but no sooner than 1 year from the date that they issued those payments to you. So this was part of the CARES Act. They said that that was an option, and what was amended was the repayment, as far as it was supposed to be 10.4% or something like that, and it was a lower interest rate of 4%. But here's what they're doing. What they did in the revision was they pushed repayment to a year instead of 120 days. Remember, this repayment was supposed to start September 1st of last year. Well, after a lot of, pushing, it was moved to a year, but this has always been a loan. So here's how it works. If you're starting to see these offsets, and right away, those of you that if you had providers that did that, and you know who you are, and because I've already gotten some emails from staff who are part of my Coding Corner membership, and they're like, oh my gosh, Terry, we told our doctors not to do it. We even said, our consultant that you guys pay every year to be part of the membership said, do not do this. And now they're like, well, now how do we offset this? And they're like, you can't, because how these are being taken out is that they're offsetting your Medicare checks. It's almost, they were going to allow you to repay it or put it aside and repay it, but they haven't told us yet how to do that with the extension. So they're basically beginning 1 year from the date they issue the payments, and then continuing for 11 months, they'll recover 25%, for that after the 11-month period. Then they'll continue to recover their remaining payments from Medicare payments due to providers and suppliers. Now it goes to 50% for the next 6 months. And then after the end of the 6-month period, now your MAC carrier will issue you a demand letter for full payment and of any remaining balances of the accelerated payments. If they don't receive payment within 30 days, interest will accrue at the rate of 4% from the date that your MAC carrier issued you the demand letter, which to me, there should be some kind of a receipt there. After that, they'll assess interest for each full 30-day period that you fail to repay the balance. And also what they will do after a 90-day period, if you still didn't repay, they will stop Medicare payments. You don't want to do that because that's going to be a problem, and they're going to just start taking all of it out. And so please, 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 if you did the accelerated or advanced payments, please understand that and go to that MedLerd Matters update. So make sure that you are checking that out. One of the other things that came up is the sequestration, and I know that a lot of you have seen some of the new alerts about the sequestration. Basically what that means is that we have a 2% that gets taken out of our payments. We've had it since 2011 when the Obama administration raised the debt ceiling, and they had to take out, remember, whenever the government, I don't want to be included in anything they're doing now because it's just crazy how much money is being spent. But whenever money is spent like that, in a point where you're like, where's this money coming from? They have to find it. And they always attack the Medicare program. It never fails. And so when they did this, in 2011, 10 years ago, they attacked Medicare by adding that 2% deduction that's supposed to help pay for this. Well, that was put on hold last year and in August, and now it was supposed to restart again. Well, Congress basically said that, or the Senate said that they would go ahead and put that on hold again. So it's not going to go away. It's going to be put on hold again. So it did pass in the Senate, but it has to now be made into temporary law by the House. So what's happening is that now your government is on spring break or Easter break or whatever you want to call it. And remember, the government gets 2 weeks when we get a day. Do I sound snarky today about that? Sorry. But I just don't know anybody who takes off more time than our federal government, more time off. But anyway, so that's after April 13th, that'll be signed to stop those. Well, in the meantime, what they're doing is they're saying that they're going to hold your claims. So for those of you that are heavy Medicare providers, your claim for any dates of service on or after April 1st will be held until that's put into temporary law by the House as far as to hold that 2%. If it doesn't get done, and that what they're saying is that anything that gets processed or slid by with the 2% taken out, then they will automatically reprocess it. You won't have to do anything. But they were directed, or all MACs were directed, to hold your claims until further notice. So hopefully it won't be longer. It's funny because they said, let's hold your claims so it doesn't stop or hurt your cash flow. Well, holding claims does hurt your cash flow. So I'm not really sure what the mentality on that one is, but just so you know, that's what's going on right now as far as that sequestration. What I want you to pay attention to, though, is the fact that there is a 4% that was put in the last, they called it the rescue plan. Well, I'm not sure who it rescued, because if you look at it, 4% is supposed to be attached to Medicare. That wasn't a faux pas, by the way. So attached to Medicare starting in July to now pay for that last $1.9 trillion relief plan. And I don't know if you're watching the news, but they're supposed to now he's saying that he wants another $2 trillion. So they're printing money in the basement, apparently, but this is where these things come from. Our taxes, Medicare, it attaches programs that are funded by the government, and they transfer that funding to this spending. So please be aware of that. This affects you directly. And I hope nobody, and I know some of you get a little upset with me when I get a little political, and I apologize for that. But this is a bipartisan issue. These are your Medicare payments. And regardless of who your political affiliation is, your Medicare payments are going to be attacked because of spending. So who's ever spending it, it's coming out of your pocket, and you need to let your providers know. So that was part of one of the last bills as far as trying to figure out not to do that 4% and take it from another program. I hope it's from a foreign aid program, because this is U.S. stuff that we need paid for our patients and for our providers. And I don't like it when they attack things here at home. So just keeping a lookout. That's how they kind of get their money back, and not just with taxes, but also with attacking programs. And they're federal programs. The federal programs is what gets hit first. So I just wanted you to be updated on that, because at some point that is going to really be an issue. And I just didn't want you to be blindsided if you didn't. But that's just 2 of the regulatory updates. And I wanted you to be aware of that, because that could be a huge issue moving forward. But there's a lot of other things. So hopefully you will go to the NSCHBC website and registered for the upcoming first quarter Medicare update. So there's a lot of information that is coming out, and I just want you to be aware of it. Okay, so let's take a look at my specialty coding question. So in the past several months, I've been asked about depression screening, and that's the Medicare code G0444. And that has a time threshold of 15 minutes, and it's considered a preventative medicine service. It is billed once in a 12-month period, and so it has a frequency guideline. It is only offered via telehealth during public health emergency, and it can be an audio only during the public health emergency. So otherwise, it's a face-to-face service. So if your physician feels that there are red flags with a patient and the conversation needs to take place during an annual well visit or one of the yearly physical exams, it's paid at about $18. But the thing that I really like about this, and I'm just going to come out a little bit weird, but I just keep thinking about all of our Medicare patients who have probably shown some signs of depression during the pandemic. And your physician, maybe has seen a couple of red flags about that, and maybe an annual depression screening is appropriate. We've had a year of, this quarantine and sequestration and just everybody having to, be so careful and be isolated from their family. And I know that, I don't have depression, but I know it's made me, feel depressed a little bit, only because, I couldn't see my daughter until I made sure she was vaccinated. I couldn't go to a certain place. And I'm sure all of you feel that way too. It's not just me. And I know that when my father-in-law was in skilled nursing, my husband could not go and visit him. And it was really tough. He had to be outside the window. And so then when he passed away in October, it was just so hard on the family. And I know that, my father-in-law was probably had some problems as well, just from a mental health perspective. And so really look at this code. It's a screening. So it just means that There could be some things there that you just want to ask some questions. Now, who is it billable from? So it is a primary care service. And so that in a primary care setting, it says with staff-assisted depression care supports in place. And what does that mean? Well, from the MedLearn Matters article, it says, and I'll quote it, at a minimum level, staff-assisted depression care supports consist of clinical staff, so a nurse, a physician assistant in the primary care office who can advise the physician of screening results and who can facilitate and coordinate referrals to a mental health treatment center. More comprehensive care supports include a case manager working with the primary care physician. There may be planned collaborative care between the primary care mental health clinicians, patient education and support for patient self-management, maybe some special attention to patient preferences regarding counseling, medications, but it's really just a screening to see if they need to be referred, but also with the continuing involvement of the patient's primary care physician. So again, above and beyond the annual well visit or the yearly IPPE, the physical exam, you can bill the GO444 once, and it is once per year, and it is for 15 minutes. Make sure the time threshold is there, and it's low reimbursement, but for $18 just to check this out, it really couldn't hurt. It's not a bad idea to at least take a look at it. Our coding question today is brought to you by Keck Medicine of USC, over 500 nationally renowned doctors at a leading academic medical center, keeping you healthy, on track, and doing the things you love. The Keck Effect, keckmedicine.org. So I'm going to end today with my personal tidbit this week. Really, I just wanted to shout out again some great messages, you guys. Thank you so much. I just received such positive about my Codecast content in the last couple of months. Joelle, thank you. I actually got her message this morning. And Janelle R., Alex, Nancy O., Sylvia, Lisa B., Eileen V., and Kelly Z. You are all very much appreciated, as all my listeners are. And, sometimes I really need that positive lift when things seems to be just crashing down as far as all the regulation and just some things that you're just like, oh no, not this again. So thank you again. I really appreciate that. And I am such a positive person, so it really adds to the positivity for my week. So again, I hope everyone makes it a great day and a great week, but that's it for me this week. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.